So why don't we get started actually with the news of the day? People might have just heard on the national news that the federal bill for Pharmacare bill is going through. They're looking at what provinces are going to be doing with agreements. So British Columbia has already signed a memorandum of understanding with the feds. Alberta has said they're withholding, getting involved in this. Where's Manitoba at? Just to reiterate, what our plans are moving forward with Pharmacare.
Well, we're doing a lot in this area, so I can definitely share some information here. First off, here in this news this morning, it sounds like good news for Manitobans. I think we all want to see stronger healthcare, stronger Pharmacare coverage. And so what I would say as a starting point is that as a provincial government, we're already moving in this direction. So many people listening today will probably know that on October 1st this month, birth control became free in Manitoba, and that's something that we did out of our own budgetary resources. We're moving ahead with that. So with the federal government now coming forward and passing this law, we can move more strongly in terms of seeing if there's additional federal resources to help bolster that plan, as well as some of the other drug coverage that you heard the Prime Minister and other federal leaders talking about. I'll give Jagmeet Singh some credit here because he was in our province several months ago saying, you know what? Start the negotiations now because this bill will pass and you can start the negotiations even before this thing comes law. So to your point about British Columbia already having a memorandum of understanding here, we've been negotiating with the feds on this already. So this bill becoming law or getting approval at the Senate, I think is an important milestone, but there's already a lot of legwork happening. We have some of the coverage out the door already. We're going to be looking at next steps. And if I could just share a quick piece of info about BC, what they were able to do, because in BC, like Manitoba, the province was already covering free birth control. They were able to use some federal resources to look at other forms of health coverage for women in particular. And so what BC did is they're now covering HRT, hormone replacement therapy, for women and for folks who are experiencing menopause to be able to get that additional level of support in the healthcare system. So that's not something that we can say that we're in a position to announce here. But as this federal coverage and federal resources come out the door for a province like ours, where we are very focused on healthcare, where we already have taken a step to make birth control free, that's why I say it's good news, because potentially this means there are additional ways that we can help more people in Manitoba.
So I'm hearing you say additional. I'm hearing you look at BC and say they funding their birth control and using the funds that are coming, not to take over that funding, but to add additional resources.
Well, I think both, right? They're using that to support the birth control initiative, and then they're also using that to maybe branch out into some additional areas.
So it's not like you'll have a Manitoba Pharmacare program plus a federal program. This will all eventually the birth control.
You're the patient. You show up at the doctor's office. You take your script to the pharmacy. It should be all one seamless experience, basically.
Do we know if the funds that you're funding the birth control initiative with now then will go back into the provincial pocket, because though the funds from the federal government will take over that portion of what you're offering?
Well, it's too soon to say because we don't have that deal finalized. But what I am suggesting is potentially, instead of just saying everything nets out or everything just kind of like is even in the wash, so to speak, that there might be a way where we can be creative, working alongside the federal government to say, all right, birth control is covered. Are there additional coverage, additional forms of coverage for other forms of women's health, other forms of reproductive freedom we would be able to now extend? So those are where the negotiations and conversations are at now.
Just as a last question on this, is there to be clear, Manitoba does not yet have a formal memorandum of understanding with the feds as BC does?
Well, I'm sure we will do a big fancy announcement when we have all the paperwork done, so to speak.
It's coming.
Correct.
Let's go to another story. Lac du Bonnet, we actually have a clip to play for you here, Premier, because we were there yesterday. CBC was on site. As you know, the town's been planning for a new personal care home for more than a decade. In March, you said there would be shovels in the ground this year. Gordon Peters yesterday has been trying to get this facility built for years, so we heard from him on the show. Here's how he described how some of the people in town are feeling.
They're a little skeptical because of the March announcement, nothing happening during the major building season. So there's some considerable skepticism after 30 years, which is understandable, but I know that there's a lot of excitement in the development of this.
Are you still confident, Premier, that construction will start before the end of December?
Yes, and the March announcement that he's referring to, and thank you, Gordon, for reminding folks and to hold myself and the rest of our team accountable. At that announcement, I said specifically shovels in the ground this year because I want to invite the accountability. And also for our team who's working really hard on this, if I say it publicly, it also puts a little bit more onus, a little bit more urgency behind, yes, we have to deliver for folks in Lac du Bonnet who've been waiting so long for this personal care home to get moving. So very intentionally, I said shovels in the ground this year because I want us to hit this target. I want us to be held accountable by the community. And so what I can say is this thing is not moving as quickly as I would like. However, we are going to get shovels in the ground this year by December 2024. December is my birthday month, and if I have to come in on my birthday on the last day of the year with a shovel myself, I will do so in order to move this project along.
That's an answer. Let's go to another clip, actually, we have, because we've been covering a lot of topics this week on the show.
Sure.
So one of the other ones was the Accessibility for Manitobans Act, speaking of things that have been long in the works and promised by multiple governments. This was supposed to set standards for people living both with physical and mental disabilities, as you know. It became law 6 years ago, yet the most basic things like having a washroom that works are still an issue. So this is just a small clip of Lindsay Cook. She's CEO of Manitoba Possible. We had her on the show earlier this week. Here's some of what she said.
You know, what I'm really pleased to see is that Manitoba adopted the National Building Code 2020 last year. So that came into effect January of this year. And the National Building Code 2020 edition actually includes quite a lot of provisions for accessible washrooms. The challenge with that is that that is for new builds and that's for significant renovations. There isn't other legislation planned under the AMA, which surprises some people. There will not be legislation that covers the built environment. There's advocacy efforts such as groups like Barrier Free Manitoba that are pushing to return to that built environment standard. But as it stands now, that will be designated to the building code, which will not have an impact on the vast majority of spaces currently inaccessible.
So what do you say that and the concern around the fact that there's not legislation planned for the built environment, which is, I mean, it's wonderful to say new builds are going to be accessible, but so much of where we live is going to be people that are just still continuing to face barriers.
No, and this one's really important to me because actually my predecessor as the MLA for Fort Rouge, Jennifer Howard, was the minister who brought this Accessibility for Manitobans Act into law here in this province. And she did a lot of work with the business community in particular to bring them on side and to help ensure that there was a bridge between the needs in the community, but also that sustainability for business, if you will. And so the way the AMA works is that the law is basically like an overarching umbrella. And then underneath that, there's 5 standards. And right now, 4 of those standards are implemented. And our Minister of Families has launched a consultation on one of the remaining standards that needs to be decided. But to get to the point of what Lindsay is talking about there, the built environment standard is one of those 5 standards. And this one was passed under the PC time in office. And we raised some of the same criticism, then opposition, as Lindsay is now, which is that the built environment exempted basically all existing buildings, which causes a concern for people in the disabilities community. There is a statutory review for this bill. So it will come up for renewal at some point. And then that will be the opportunity for us to work with the advocates in the community, the people with the lived experience, to be able to address some of these concerns. And I know, you know, CBC as a platform, you've done some excellent work in sharing some of these stories of people who are
Can't you just say now to like the business community, look, like this is the law, and put some pressure, or can you get the timeline to be more urgent to get these built environments better working for folks?
Yeah, and what I'm saying is that we are working on that. Like with that consultation that's out in the community on one of the remaining standards under the AMA, we are out there working with folks with lived experience and advocates in the sector. We're also taking action in some really important areas. There was another announcement this week from our Minister of Families on supports for people living in the community with disabilities, and it had to do with an equity complaint called Sumner Pruden. Basically, there is a wonderful person living on a reserve in Manitoba. His name is Dewey. And his mom brought forward a complaint saying, you are discriminating to the provincial government against my child because you do not offer CLDS, Community Living Disability Services, and home care on reserve. And so our government this week announced that we're taking what I think is a very significant step to just level the playing field and allow our province to live up to that phrase, every child matters. which is to say that home care and community living disability services will no longer end at the boundary of a reserve in Manitoba. So now going forward and into the future, people in the community with disabilities, whether you live in the city of Winnipeg, whether you live in a rural community, whether you live on a First Nation, will be able to access the same quality of services in community so that you can live with dignity. To me, this is a very, very big change that will change things for generations to come. And of course, we're going to have to do a lot of work around staffing and service delivery improvements to be able to make good on it.
I was going to ask you about achievements you've made in the year since you've been in office. I want to switch gears now because
Okay.
I want to ask you to address some allegations that people in Fork area, I believe, deserve some answers to. They voted in Mark Wasiliu as an NDPer. He's now an independent MLA after being ousted from your party, but he has made some serious allegations. Wasiliu has said that you, quote, lunged at him during a campaign event in the summer of 2019 and said, quote, I'm the leader, you do what I tell you to do, end quote. He alleges he was asked to, quote, lie for Wab, end quote. I know you have heard these allegations. The PCs have now called for the ethics commissioner to look into this as well. Is any of this true, yes or no?
No.
Any part of it?
No.
People who are listening might wonder if they should have concern about how you lead your team, toxicity at the ledge, or what all of this is about. Hearing this, how this has unfolded. What would you say to them?
Well, I'm focused on you. We were elected by Manitobans to fix healthcare and to make life more affordable. So what we've done with 1 year in office is that we've hired 873 new people on the front lines of our healthcare system. We've reopened emergency rooms that were previously closed under the last government. We cut the provincial fuel tax to save you money, and it slowed inflation in our province. And so political opponents like the PCs and others, they can keep talking about me. I'm going to keep talking about you. And we show up for work each and every day, humbled by the awe-inspiring task of trying to make Manitoba a better place, which is the mandate we were given by the people of this great province.
Appreciate you answering our question.
Of course.
You announced this week, 826 Premier Wab Kinew with us. These interviews always cover a number of topics. And you made an announcement this week on new machete legislation. How's that going to work?
Well, it's actually similar to what happens with bear spray in the province right now, which is that we're asking retailers, first of all, to check IDs and then to keep a record of sales. One thing that this does is obviously it restricts who can actually purchase a weapon like this, but then it also creates a paper trail. So that if there is an investigation for one of these terrible things that we keep hearing about in the community, that there'll be the ability for law enforcement to hold people accountable. And so I think we've been working very hard on public safety. I'll give credit to our Attorney General here, Matt Wiebe, who's been doing a lot of things over the course of the past year to make Manitoba a safer province. And this is us, again, listening to some of the concerns both from law enforcement but also from the community. People who are talking about, violence. But I want to also point out the following. While we're taking these, tough on crime steps, we're also tough on the causes of crime. And if we want to talk about how do we make Manitoba a safer province 5 years from now, 10 years from now, 20 years from now, I think the most important thing that we've done this past year is starting a universal school food program in Manitoba. That is going to keep more kids in class. We've heard directly from inner city teachers already who are saying we have dozens of kids showing up who were not showing up last year. But also over the course of those children's lifetime, their educational achievements are going to grow. Their lifetime income is going to be higher. They are going to be healthier as a result. And most importantly, on the public safety conversation, when we're talking about that dynamic, then communities are going to be safer when we keep more kids on the positive path.
Just as a last brief question before you go this morning, I want to ask you if you know when you're going to make your decision about whether or not the province will permanently fund the police officers through the Retail Theft Initiative.
So I don't have a specific date to share for you right now, but I can tell you we're actively looking at it. This is something that has clearly been very well received by community and by business leaders and a lot of other folks out there. So I think the inflection point where we're at is trying to balance the new police officers who are graduating from the academy, if you will, the existing use of overtime, and just trying to get the balance of resources right. But listen, we've heard loud and clear that this thing is working and that it's well received. And so we're very, very seriously looking at how do we continue that success.
Thank you very much for being here.
Yeah, thanks so much for having me.